Welcome to the Healthcare Authority's presentation on the Hospice Program. Topics that we will cover during this presentation include a hospice overview, the hospice agency, requirements of hospice payment, client eligibility, different scenarios, hospice as a program, hospice in a skilled nursing facility, hospice and other programs, ProviderOne Access, and resources. Overview. The HCA Hospice Program is a 24-hour-a-day program provided by an interdisciplinary team for persons with a terminal illness and a prognosis of 6 months or less to live if the illness runs its normal course. The hospice program allows the participant to choose physical, pastoral, or spiritual, and psychosocial comfort and palliative care rather than a cure. Hospice care is initiated by the choice of the client, family, or physician. The client's physician must certify a client as appropriate for hospice care. Hospice can be ended at any time by the client or family, which is called revocation, by the hospice agency, which is called discharge, or by the death of the client when the client expires. Hospice care may be provided in a client's home, in a medical institution, including a hospice care center, a nursing facility, or in an alternate living facility. The hospice agency. How does a hospice care center become an approved provider with Medicaid? To become a Medicaid hospice care center, the hospice agency must be enrolled as an approved hospice agency with Medicaid. And for more information on this, see information provided at this web link for the billing guide. Or you may submit a letter of request to the Healthcare Authority Medicaid Program to the Hospice Program Manager at P.O. Box 45506 in Olympia, Washington 98504-5506. A hospice agency must provide all of the following documentation confirming that the agency is 1. Medicare certified by the Department of Health as a hospice care center, and 2. That they are approved by the Centers for Medicare and Medicaid Services, which we refer to as CMS, in an approval letter. A hospice agency qualifies as an approved hospice care center with Medicaid when all the requirements are met and the Medicaid agency provides the hospice agency with written notification. Requirements for hospice payment. Many Apple Health clients are enrolled in managed care. Clients who are dual eligible, having Medicare and Medicaid, however, are not enrolled in managed care. Clients in managed care must see only providers who are in their plan's provider network unless prior authorization is made or emergent care is required. Always check for a client's enrollment in managed care before providing services. For more information on this, see the information provided at this web link, Apple Health Managed Care page. Medicaid payment requirements. When does hospice care end? Hospice care ends when the client or an authorized representative revokes the hospice care. You may refer to RCW 7.70.065 for more information on that. Or when the hospice agency discharges the client, or the effective date of the order written by the client's physician, or the day the client dies. For Medicaid payment requirements, the election statement must be filed in the client's hospice medical record within 2 calendar days following the day the hospice care begins. An election statement requires all of the following: name and address of the hospice agency that will provide the care, documentation that the client is fully informed and understands hospice care, and the waiver of other Medicaid or Medicaid services, or both. Effective date of the election, signature of the client or the client's authorized representative. The hospice agency must notify the healthcare hospice program manager of the start of care date within 5 working days of the first day of hospice services. This includes clients with third-party or Medicare coverage, or both. It also includes all Medicare clients who currently reside in a nursing facility or will be admitting to a nursing facility who have not yet applied or been approved for Medicaid to cover the cost of room and board. If a client has Medicaid and the hospice agency does not plan to bill Medicaid, the hospice agency still must send the Medicaid agency a completed HCA Medicaid Hospice Notification Form HCA 13-746. The HCA 13-746 form is needed to ensure the correct program is chosen for the client. It is required to notify HCA when a client has elected hospice, since most items are included in the hospice rate. Why is submitting the HCA 13-746 so important? The form must be received within 5 business days from the begin date in order for Medicaid to pay back to that date. For an exception to this requirement, which is very limited, see slide 18. In this page you can see a hard copy of the notification form. Medicaid Hospice Notification. The following are some circumstances in which an exception may be granted for late notification. Those include fires, floods, earthquakes, or other unusual events that inflict extensive damage. This would mean the provider is unable to submit the form due to HCA systems issues that are beyond the control of the provider. Other circumstances determined by the agency to be beyond the control of the provider. Note: such circumstances do not include failure to submit the form for a Medicare client in a nursing facility or likely to be placed in one because no application has been made or completed at the time of the hospice election. Client eligibility. A person must be eligible for one of the Apple Health programs listed in WAC 182-501-006 or the Alien Emergency Medical. Requirements that must be met include verification of age and identity, citizenship or a satisfactory immigration status, residency, social security number, assignment of medical support rights. Note: Medicare is the first payer for those who receive Medicare. Hospice as a service. To elect to receive hospice care through HCA's hospice program, a client must have the physician's orders and certification and be eligible for an Apple Health program that provides the following scope of care: alternate benefits plan, the categorically needy program, the medically needy program, or the alien emergency medical program for cancer treatment and kidney disease programs only. Different scenarios. Submitting the election notice, the HCA 13-746, within 5 working days of enrollment helps to ensure that the client meets Medicaid criteria on the date of enrollment when you submit claims for Medicaid payment, and that the correct Apple Health program is used to make the client eligible for Medicaid coverage. Payments made under the wrong Apple Health program must be recouped so that correct payment can be made by the hospice agency. This includes a hospice election in a nursing facility. When a client chooses to leave hospice care or refuses hospice care without giving the hospice agency a revocation statement as required by WAC 182-551-1360, the hospice agency must do all of the following: inform and notify in writing the HCA Hospice Program Manager within 5 working days of becoming aware of the client's decision, and not bill HCA for the client's last day of hospice service. When a client leaves hospice, continued. Fax a completed copy of the HCA Medicaid Hospice Notification Form, the HCA 13-746, to 360-725-1965 to notify HCA that the client is discharged from the hospice program. Notify the client or the client's authorized representative that the client's discharge has been reported to HCA, and document the effective date and details of the discharge in the client's hospice record. A hospice agency may discharge a client from hospice care when the client is no longer appropriate or no longer certified for hospice care, is seeking treatment for the terminal illness outside the plan of care, or is discharged for cause. At the time of a client's discharge, the hospice agency must inform and notify in writing the HCA Hospice Program Manager within 5 working days of the reason for discharge. Refer to the provider guide for additional requirements. The scenario in which the client opts out. A client or authorized representative may choose to stop hospice care at any time by signing a revocation statement. The revocation statement documents the client's choice to stop Medicaid hospice care. Refer to the provider guide for additional requirements. After a client revokes hospice care, the remaining days within the current election period are forfeited. The client may immediately enter the next consecutive election period. The client does not have to wait for the forfeited days to pass before entering the next consecutive election period. When a client dies, the hospice agency must inform and notify in writing the Medicaid agency's hospice program manager within 5 days, and fax a completed copy of the Medicaid agency's HCA Medicaid Hospice Notification Form, the HCA 13-746 that documents the date of death to the Medicaid agency, hospice, and PPC notification number at 360-725-1965. Hospice as a program. When a client is not eligible for regular, categorically needy, medically needy, or ABP coverage, and resides outside a nursing facility or hospice care center, the home and community-based waiver rules are used to determine financial eligibility for hospice as a program. This program has higher resource standards when the applicant has a spouse, and there may be a cost of care or participation the client has to pay to the provider. Hospice as a program may be used to provide CN coverage for a client at home or residing in a residential facility. CWAC 182-513-1240 and WAC 182-513-1245 for rules used to determine financial eligibility and patient participation for hospice as a program. For a client with higher income who resides in a nursing facility than the institutional rules in WAC 182-513-1317 may be used for a determination of CN eligibility. If a client's income is still too high for CN coverage, then MN coverage may be approved with a spin-down amount. One of the requirements for eligibility under hospice as a program is that a person must attain institutional status as described in WAC 182-513-1320. To meet that requirement and to ensure the correct program is used to provide coverage, the HCA 13-746 hospice notification needs to be sent to the HCA within 5 working days of the election date. This also prevents a nursing facility getting paid under a different program and then later having to use its operational funds to pay back what they received from the state. In such cases, the state must recoup its payment from the facility before HCA can pay the hospice rate to the hospice provider. Hospice in a skilled nursing facility. Once a client elects hospice in a skilled nursing facility, the hospice provider is the provider of record. The SNF daily rate is called the client's room and board. If the client is on Medicare, the payment is based on 95% of the SNF daily rate. Payment made to the hospice provider is the total of 95% of the SNF rate minus any client responsibility toward the cost of care. This is also called the client's participation. The hospice provider pays the SNF 100% of the room and board. The hospice provider is responsible to file the claim through ProviderOne and indicate the client participation amount. The hospice provider may have an agreement with the skilled nursing facility to collect participation from the client by the SNF. The hospice provider is responsible to pay the SNF 100% of the rate minus participation. The SNF should contact the hospice agency for the client's participation amount. Let's review a scenario. Mary is residing in a nursing facility and is receiving $2,050 in Social Security income and Medicare Part A. Mary elected hospice on the 4th of November 2017 and was discharged from hospice on the 9th of November 2017. The state rate is $175. So the question is, what is the split participation for November 2017? And here's the calculation for that split participation amount. $175 times 3 days for the 1st of November through the 3rd is $525 to the skilled nursing facility. $175 times 95% equals $166.25 times 5 days for the period of the 4th through the 8th of November. That amount equals $831.25 to the hospice provider. Then we subtract the $2,050 minus the $57.28, which was the personal needs amount at that time. That equals then $525 for the skilled nursing facility minus $831.25 to the hospice provider, with a remainder of $636.40 remaining post-eligibility treatment of income, or PETI, to the skilled nursing facility. If a hospice client is also approved for a long-term services and support program, such as COPES, New Freedom, or a DDA waiver program, the LTSS program takes priority over hospice. This means the client pays their responsibility to the cost of care to the LTSS provider, and hospice is considered a covered service under the Medicaid. Hospice and other programs. Since Medicare will cover hospice services, the client may not need Medicaid if they remain at home. If they will need to go into a nursing facility, however, they will need Medicaid to pay for the facility's room and board costs. For more information, please visit the web address below. Apple Health may pay for services in a client's home, a community residential care facility, an assisted living facility, an adult family home, or nursing facility if the client meets certain criteria based on the comprehensive assessment, reporting evaluation, or care. If the client needs LTSS, contact Home and Community Services and see resources at the end of this presentation. When these needs cannot be met at home, care in a residential or nursing facility is available. ProviderOne Access. ProviderOne Security is the team who administers and supports access to the ProviderOne payment system. For information on how to become a Medicaid provider and related ProviderOne account information, visit this web address. For information on Medicaid billing for fee-for-service medical providers, visit this web address for that information. Resources. We have compiled here a list of resources to help you with any remaining questions. At the web addresses below, you can find the Hospice Services Billing Guide, the Medicare Hospice Benefits, the Hospice Chapter in the Apple Health Manual, the electronic DSHS forms, and the ALTSA long-term services and information. Home and Community Services contact information for Region 1 and for the counties listed there. There is a phone number and fax number. For Region 1 also, for a different list of counties, there is a different phone number and fax number. For Region 2, there are also 2 different offices to call. For the first Region 2 listed, those counties can be contacted at the phone number and fax number provided. And then for King County, also in Region 2, there's a separate number and fax number for your use. And then for Region 3, for the counties listed there, a separate 800 number and fax number are provided. HCS Regional Social Service Intake. To request an assessment for LTSS, please see the areas and phone numbers below. For Region 1, which includes the counties listed here, there is a separate phone number, actually 2 phone numbers, and a fax number. For Region 2, the northern part of Region 2, which is the counties listed here, there is a separate phone number and fax number. And for the southern part of Region 2, which is King County, there is a separate phone number and fax number. And for Region 3, which includes the counties listed here, there are a couple of phone numbers and a fax number. Thank you very much for the time and attention you have given by watching this presentation.